My name is Tendi Aris. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists. People call me Dr. Alternative out of endearment. The health industry or health has got two dimensions: the alternative dimension and the medical dimension. But unfortunately, these two dimensions don't talk and they don't collaborate, to the detriment of the recipients, that is the patients out there. I am the epitome of these two dimensions.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
Welcome to Dr. Alternative. We are back again, and we are excited to be engaging with you in this episode. We'll be making a follow-up on the previous episode where we were discussing the results of Jason's scan. Today I've got the two ladies that are going to introduce themselves.
Hi viewers, my name is Xolile. Welcome back to another episode of Dr. Alternative.
Hi viewers, my name is Lorica. Welcome to Dr. Alternative Show for another exciting topic.
This is a springboard from the previous episode where we were giving the results of Jason's scan. We thank you very much for your comments. We appreciate them, and we encourage everyone else who wants to share something or even ask a personal question. Some questions we may answer personally, directly to you. Others we may discuss them on the show as we are doing today. I'm going to hand over to the ladies because they've got some questions, some which come from your input. So they're the ones that are going to drive the show today. Okay.
Okay, I start off with my questions. I'm sure everyone who watched the previous show was amazed that the patient who was bothered with only a knee problem ended up getting such a detailed diagnosis. What does this mean? Are we getting a raw deal from the doctors?
Yeah, actually, yeah. I know I'm going to get a flag from the doctors for saying this one. But I think most people are getting a raw deal. Because, like I've said in the past, the body consists of a lot of systems, different systems. Your cardio, your skeletal, central nervous system, your respiratory system. I mean, there are so many systems of the body that are systems on their own. But all these systems, they work collectively to the body, to serve one body. And if you look maybe also at how conventional medicine has dissected the different qualifications, like you will have your GP, general practitioner, you will have your physician who has specialized in in these, but generally, but now with more information. Then you will have your pulmonologists that deal with your respiratory system. You will have your cardiologists that deal with your cardiovascular system. You will have your gastroenterologist who deals with your gastro. There are so many entologists, so many specialists. But these specialists, what they do is they study extensively that particular system. And then when therefore you're presenting with systems that are relevant or that fall within that category, then you will be referred to that specialist, which is fine. But the problem that I have with that method is that while they talk or they look at the special information or the qualification of that person, then you find they actually don't connect to the other system. So then you find that they don't connect to other systems. Like I give you an example that I do get, and this is now quite common, people that have got respiratory problems. You will find that most of them belong to a pulmonologist. Whether they are diagnosed as having asthma, the majority of them you'll find they say they've got asthma. There's a lot of people that are diagnosed as having asthma, but who actually have cardiac problems. So their breathing issues, their respiratory issues are not in themselves because of the respiratory system, but the problem is emanating from the cardio. But because of this specializing of conventional medicine, you find they focus, they keep giving you the medication for asthma or lungs that are phlegmy or that are dry or that have oxygen that are not pumping enough. So you find that they're focusing there. Meanwhile, there's the tap that's bringing in respiratory issues. So then you find you're never going to come out of that problem because the focus is in there. And the cardio, no one is talking about cardio. Okay. So this is what I get a lot when people come to me. Okay. I remember just at the top of my head that I had one patient who I think it was last year when she came to me, and then she says, when I was about to give her results, she says, my mother said I must send her greetings and tell you that she should have listened to you. I said, why? She said, because you told her that her asthma, which was her diagnosis, was actually not asthma, but she had serious cardiac problems. And she never believed you. As a result, she never came back to get treatment or whatever because she discounted that diagnosis. And she said today she's got a pacemaker because that heart, only then did they discover that there was a problem with her heart. So now the pacemaker is the device that they put on to your heart, next to your heart, so that it helps the heart to pump, improve the rhythm, the pumping ability of the heart. So she was telling me that my mother said if she had listened to you, because you told her that time already. And at the time when she was reminding me, there was no one who even looked at the heart. I was the person who said heart problems. So what I'm saying therefore is I've got serious concerns with how conventional has dissected the body without making the body talks to other systems. Because you may find that one system may cause the problem and you will not even think that this would be the case. But look at the case of Jason. Jason has got a knee problem. So the focus is on his knee. For 2 years, they say inflammation. Meanwhile, the problem is actually coming from the thyroid. And it's coming from the thyroid, which thyroid is affected by the multiple endocrine neoplasia. Okay. So you see what I mean? That this person comes with a knee, but you see, there's the tap that's leaking the water. So now when you go to your doctor, he gives you an injection, he gives you an antibiotic, he's looking at that knee. He's holding onto that knee. Meanwhile, the rats are coming from all over. But he's watching and he's wondering, why is this knee not coming all right? So that is what I'm talking about therefore when I say yes, to some extent, people get raw deals from their doctors. But then, who do you blame? Having said that, is it the doctor's fault? Or is it the curriculum, their training? Or who do you blame? Seriously, who do you blame? Because remember, these doctors are made by the curriculum. This is the curriculum that determines what areas are going to be covered. So when you say I'm specializing in this, then they go all the way out. Now, are you subjecting yourself to limitations by going all the way? Because maybe I had one lady a doctor actually, a psychiatrist, who came from Joburg, who was my patient, who came down. And we were discussing this. And she was saying that their curriculum, their education, they're given a lot of detail when they specialize, because now she's a psychiatrist. So you're given a lot of detail in that particular area. Detail which you find at some point you don't need that much. But you spend all the years and all the monies and the whatnot following all the way. Maybe what you need from that maybe is just maybe 30% of all that information. The rest you're never really going to use because you don't even know how to connect that 100% information to what you need at this moment. So those are the issues that are facing the doctors, which therefore make you get a raw deal because that's how they're trained, you know? Yeah. Maybe I can give another example just to clarify my conviction. You know, this I have mentioned in the past. I had because this is now why I'm more interested on this one is because it was under a professor. Okay. This is a person who was having epileptic seizures, you know. And the mother said to this child, he was now 30 years when he was brought to me, but he started having seizures when he was 3 years, when he was a child. But now the reason why these seizures were fascinating to the doctors is that the EEG, which is the machine that measures the brain waves that will tell if there's been an abnormality and where is it localized, it picked up nothing. When you're having seizures, the EEG must be able to say you're having seizures and this is where the abnormality is occurring. But now when we're testing this child, there was nothing. The brain was normal, which was odd. So they were putting him on the treatment, changing from this, from that, because the seizures were just going. And the problem with the seizures, which I also want to stress, because there's a few people that I pick up that they've got seizures who are not aware that they've got seizures. The problem with the seizures is that when you are having that attack at that moment, it's actually damaging the brain cells. So when you keep on having such that you'll find that there will be people, particularly those that are already known as having seizures, you'll find that epileptic seizures is treated as an emergency. When you get seizures, you're rushed to hospital because they must contain it. You could even die from having recurring seizures that are not stopping at that moment, because as you see that the person is, even the oxygen and the whatnot, everything is just upside down. So, but now, so people may not realize that they're having seizures, but it doesn't mean when you don't realize that you're having seizures, but you are getting seizures, particularly the ones that happen at night, that the damage is not getting done. And remember, some of the seizures do not manifest as convulsions. Some people, especially the ones that we call absent seizures. Absent seizures, a person you may be talking to a person, and then the person will be like, is ignoring you. Just, like is thinking about something else. And then they come back again. So those are absent seizures. But you don't really get convulsions. And it happens a lot to children that are autistic. You know, where you find the parents, oh, this one will just ignore me. And then when his mind, you know, they don't know that at the time he's ignoring you, he's cut off because the brain is having a seizure. Also the ones where you find the children, particularly with children, it's called, those are gelastic seizures, where you find they giggle at night. And you know, once this child is asleep, then you say, it's good. That child is, in most cases, is having seizures, gelastic seizures. But then, because people don't know, they think, maybe it's the granny who passed on, who's playing with the child. You know, we always think about all those, you know. So people will think all sorts of things to explain why this child is giggling at night, you know. The child is not having any visit from the granny. He's actually having a seizure, you know. So that's what happens. So seizures concern me a bit because it's very easy, even for these doctors, to miss it. Because for them to be able to pick up the seizures, they must only do that. They do that EEG, but they won't pick up just from you sitting there and looking normal. So that I pick up a lot. But now coming back to this 3-year-old, what was fascinating to the doctors was the missing reading on the EEG. And then this teaching professor adopted this case, took it under his wing, and he said, I mean, let it be my case. Remember, when it's their case study, they study a lot of things, they observe, you know, to see where is what is missing, So for 8 years, this was his case study. Studying this child and all that. And I gave up because nothing gave answers. This child would be pumping like this while he's having, because now he was in hospital. So when he's having seizures, they would watch him. So when then they call the professor so that they connect to the EEG immediately to see if they're going to pick up nothing. And there would be nothing. Meanwhile, he would be convulsing like crazy. Nothing. The brain is just still. So, I mean, they were fascinated. Up to where he also gave up. He said, he cannot explain this. So when the mother was coming to me, he was now 30. And this had affected his brain. Because, I mean, you could see that there was some mental instability. Because even though he was taking treatment, the seizures were coming. So the mother was not hoping that I was going to help her child. She just wanted to know what is wrong with this child. So, and she was at peace with the fact that he's just going to take treatment up until. So there I scanned this child and I'm like, the problem is not coming from the brain at all. It's actually the same condition that Jason has got. It's a pancreatic problem. Now, when I was giving Jason his results, I told him that his pancreas has got insulinoma, and insulinoma, it's those, the tumor that ends up causing insulin. It uses up a lot of insulin, you know. Meanwhile, that insulin is needed to transport that sugar to the various areas. But now, when you've got insulinoma, it's pumping too much insulin. It's taking too much insulin. You're overproducing insulin, which therefore you end up using it. It uses it at the same. So insulinoma is the opposite of diabetes. While diabetes, you're lacking insulin, insulinoma, you're overproducing it. But now remember, that insulin that you are producing it so that it transports sugar to the various regions of the body. But now when you're pumping too much of it, it's that sugar that it's supposed to be transporting, it's actually devouring that very sugar. Then you go on the low. So that's what was happening. Even if you were looking at him, I mean, when I was discussing him, I mentioned that he would be fine. Then all of a sudden he finds his energy level just go, you know, which he concurred to that he would be sitting there and he would just want to go away from that place because he feels his, you know, his energy. So it does that and it causes a lot of thirst. If you saw, he was non-stop drinking. So that is what was happening with this particular one. But then it was causing that brain to go into a shock because the brain needs sugar for the whole body. So when the brain is overstressed, stretched, or too much stress or too much, it shuts down. It goes into, you know. So then he would have those seizures. So he had huge insulinomas. So I had to shrink that, and that's what stopped the seizures in this particular child, who's been suffering for a long time. But now, when you get a case like that, you're no longer just dealing with stopping seizures. You also deal with a brain that has shrunk because of being lambasted with all the seizures that he was having. So now you have to restore those brain cells. And people don't believe that we can actually do that. That a person may be nowhere. Even these people that have got dementia or parents, I mean, I usually watch some of these clips and I'm like, you are overseas. If I could get to you, you would stop. I mean, there's this popular a doctor who he used to be a podiatrist, but he's now seriously demented. So they do send clients. I say, I wish I could get to that old man because I could turn him around, you know, and they would be shocked that we can actually repair those damaged brain cells. So that's the, so now can you see? This is a neurosurgeon who was focusing on the brain, but the problem was coming from the pancreas, which is the endocrine system. So it's a different, but they're not talking. So this one is busy because it is area, but it doesn't know the endocrine system is the one that's causing a problem. In which case, but with me, because I can see all these systems, I see how they talk. So that, so that's the case. Therefore. Okay, that's a long way of answering that question. Okay, let's go for a break, and after the break, we continue with the questions.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to adenylase enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat.
Welcome back. We are analyzing the diagnosis of the previous show, but then I'm giving more clarity on certain things, and even the case that I've chosen today of insulinoma, I brought it deliberately so that you can see how one area can link to something entirely different. Because like you see, the one case that I brought today about this person, it was affecting his neural function, his nervous system. But yet the problem was from the endocrine system. But even with Jason, his main problem that sent him to the doctor is his knee, which is an orthopedic specialist. Meanwhile, the problem is the endocrine as well. So I'm just connecting these dots so that you can see I'm not just talking hogwash.
Okay, Tembi, thank you so much. Over to my next question. I am fascinated by how you connect the dots that end up leading to his knee problem. Is this how you always diagnose?
Yes. There is no other way of diagnosing. This is how every practitioner should be diagnosing. Because like I'm saying, these examples that I'm giving you, there's the madness, there's the epilepsy. It's the brain. You're looking at the brain, there's nothing, the brain is also a victim. There's the pancreas, that's the problem. With Jason, it's his knee, there's the problem. And you're looking at the knee. The knee is not the problem, it's the victim. There's the problem from the thyroid. Thyroid not producing, but what's hitting the thyroid? It's the endocrine system as well, because it's also, it's that MEN. So that's how I connect. That's how every health practitioner should do, because like I say, and it's not because we want to do it that way. That's how the body is made. God created the body in that fashion, created systems that work individually and also collectively. So that's how I work. Yeah.
So after the previous episode, this discussion has been asking myself that is it really that possible that person can have a simple straight line diagnosis?
Yeah. Well, if you fall and break your bone, start straight. You've broken your bone, so you've got a fracture. that would be when it comes to emergency medicine, you can have a straight line diagnosis. You've got a fracture, and there's no other thing, so we must just mend that fracture. But when it comes to how the body works, you cannot have just a straight line diagnosis, because even with the fracture, let me make an example. You might find, even with the fracture, why would this person have a broken bone? And this one, maybe let's say you, the same age, you both females, and you fall. Both fall, whether it's the car, or you slip and fall. But you both fall, and you fall. I'm trying to control a lot of variables here so that we limit to the same thing that you both females, you are maybe of a same age group, and you both fall. Mm-hmm. Okay? But then when the X-ray looks at me, they see that, no, but me, I've got a fracture. But we've both fallen from the table, slipped and fall. But maybe yours, they see that, no, you've got cracks. It's not a fracture, but your bone has got cracks. A number of cracks, So how does that happen? So I'm actually answering what you're saying. Can you have a straight line diagnosis, simple diagnosis? Yes and no. Yes, like in this example of a fracture. Mm-hmm. But even at that, why would I have a different, we both fell in the same way, but why would I have a fracture? Same femur, same part of the bone. You also had the same bone that is affected, but yours is not a fracture. It is cracked. Mm-hmm. So, but where does that lead you then? That leads you that there are underlying causes that put your bone in that state at that given point in mind. So what am I saying? That your bone density is very low. Now that is the hardness of the bone. That one who's got cracks, that means the density is very low. Whereas my bone is hard, so it fractures, so it goes. So then that takes you back to like, this was just a simple fall, but now you've got cracks. Why is your bone density so low? You know, so this now takes you back to other systems to like, why would you have a fracture? I mean, why would you have cracks? So what I'm saying is, even though I say you might have, especially in case of emergency, you know, emergency medicine, you may have a straightforward, you know, type of thing. But when it comes to the chronic conditions and what, you cannot. I don't care if even people who say, I'm diabetic. It's that is diabetes is not the departure point. Diabetes may be the departure point if you're moving from symptom, because you need to look, okay, you're diabetic, so what could have led to the diabetes? But it might not take you far enough. But where you're moving from the person to the symptom, because that's the other thing that I've got concerns with conventional medicine, is that they always diagnose from the symptom. And that's very misleading. Because like I'm saying, you may find that this person has got issues of sugar, but there are so many other things that you may find have led to that, you know, but you're not able to see them. Whereas where in alternative we move from the person to the symptom, we will pick up where the original problem is coming from, and we will even pick up that diabetes. We will have an explanation for that diabetes. Even people that you find are diabetic but are not aware. I get a lot of people that are diabetic but you don't have the diagnosis. They say, oh, even yesterday I was talking to someone and this person said they did not just do the simple test of diabetes because they suspect there's diabetes. So then they did the more advanced type of tests, but they still didn't pick up that he's diabetic. Meanwhile, he is so diabetic, it fries my brain. So what I'm saying therefore is, in medicine, because you deal with the body, which is very complex, you can't have a simple answer. You have to understand you're dealing with a very complex body, and therefore you need to be able to move from the body to see why are you having a pain on your toe. So it's a small yes and a big no.
A small yes and a big no.
A small yes and a big no.
Okay, thank you so much. So since there are people who'll be scared to hear all the details, what are literally the ramifications for such people?
Yeah, in fact, I do get those people quite a lot. They say, me, I don't want to know. I just want you to treat me. Others, I don't want to come to you because I don't want to hear all the details. I mean, it's like an ostrich. You know the ostrich? They say when the ostrich is hiding, it puts its head on the sand and then it believes. Now you see how big the ostrich is, but you see the head is small. So it put that small head under the sand and the whole body is showing off. So you don't need that head. You can just chop on that neck and take that whole body while it believes that it's sorted, it's protected. So that's what they are doing by putting their heads under the sand when they don't want to hear what's wrong with them. Because it doesn't mean when you don't know, the damage is not done. You are getting, each day you are experiencing, or you are not experiencing the symptom, because in some symptoms, some symptoms will not manifest. So but the condition is so serious. I mean, I see people with stage 4 renal failure, stage 5 renal failure, who are not even aware that their renal system has collapsed. I see people, but then you find a person is surprised, like this one particular person. Of course, it was not stage 5, but she was on stage 4. She was on stage 4 renal failure, and she was constantly or having inflammation. The doctors were aware that she was having this inflammation all the time. She would be taking medication, and she would accumulate fluids and all that. But nobody ever looked on the side of the renal system. All they focus on, you've got so many, because when they do their tests, they show the different types of pathogens that are flooding your system. Then they focus. Then they give you all this and that. So, and then I get a lot of people that are on stage 3 for cancer, who are sitting and, hiding under the sand, and they don't realize that cancer is not just entering. Cancer is so advanced. But because the symptoms are not showing, particularly cancer that is linked to bone marrow, because even conventional medicine takes too long to detect cancer like lymphoma or leukemia, because they end up having to do bone marrow biopsy to be able to pick it. So, and then you find they say, you've got arthritis, because now you might start experiencing lots of pain, they say, it's arthritis, then they give you treatment. Then you swell up, then you're bruising, then it's this, then it's that. But they don't go there. So to answer your question, a person who may be having some symptoms which are persistent, and they keep going to the doctor, they get this type of medication, and then it subsides a bit and then it comes back. You need to know what is wrong, because when we detect what is wrong, we're going to fix it. Yes. Rather than you sitting and hiding, then by the time you go and see someone and they detect it, they say, it's far gone. These people that you find, because even with cancer, even conventional will tell you that if cancer is detected early enough, they will be able to kill it, But then they say, but then what happens is, most people, when they go, they say, it's already stage 4. But how did you miss it? Because it's not like this person was not going to the doctor to say, I feel this. I tend to have swelling of the joints. They say, it's just inflammation, it's rheumatoid. So why does it take this long for them to detect that you have cancer in other regions? So back again, I'm taking it back to them again, because when it comes to cancer, this is what I tell people all the time when they come to me. Maybe a person comes with just a breast. Maybe they've been told they've got breast cancer. But then when I scan them, I see, cancer is not just only in the breast, particularly where it's coming from the bone, or particularly lymphoma. Because the lymph nodes under the armpits, they tend to get so clogged and so inflamed. They're the ones that bring cancer to the breast. So then I see people that they say, in fact, just to digress a bit, there's a white lady that I go to church with, who I could tell just from observing her that she's got a blood cancer, a bone marrow cancer. At that time, she was, in our Catholic Church, when we receive the Blessed Sacrament, those people that can kneel, we kneel. But those who can't, they bow. But she was one of those that would kneel. And then I could see after some time that she was struggling to kneel. So she was bowing, like most people were. And then when I looked at her, because she's white, I saw how her skin, particularly around the joints, turned reddish, almost blushy kind of color. And she was in a pain, even when she was, particularly in winter. You could see that she was in a pain. I could tell, I suspect, bone marrow cancer here. But then I wouldn't dare say, can I scan you? I wouldn't dare say, can I scan you? So and then after 2 years, I think, and then I see her she had lost the hair, and I like, what happened? And she said, I'm attending chemotherapy. For what? For breast. So they picked up cancer in the breast. I know she's still attending chemotherapy even now, but just for the breast. And I'm like, sure. How I wish I could tell them who are treating you that they're just focusing on the breast. This cancer is actually coming from your bone marrow. Just like I suspected that time. So what I'm getting at is that conventional will only notice that you've got cancer in this particular region. And yet, when the system that is affected by cancer gets affected, you will find that it will kind of contaminate other systems that are directly linked to that system where the cancer has originated. Like for instance, in the bone marrow, you know that when it's the lymphomal bone marrow, your lymph connects to a lot of regions in your body. But the area that I've found consistently that it tends to hit a lot is the thymic region, this area, because this is where the thymus, and there's a lot of white blood cells that sit there. So now when you've got it originating from your bone marrow, but then it ends up, because the thymus is very linked to your bone marrow, to your lymphatic system, then you find that they only pick up the breast, but they don't pick up this region. I mean, I've had situations where you find it was the breast, and then when they go back, they say the breast was on remission. One from East London was like that. The breast was on remission, but then when she went back, because she started having shortness of breath, they saw that she was already on stage 4 respiratory lung cancer. Now the question they're asking, but how did you miss it? How did you miss it? It doesn't mean at the time she went for the breast, the respiratory, the lungs were not affected at that time. But this thing of dissecting the systems and only looking, that is their biggest shortcoming. So what I'm saying therefore is, if you've got a symptom that is persistent and it keeps coming back, and then it subsides with the inflammation treatment or whatever, and then it keeps coming, you've got to check what is the problem. And that's where we come in, because we'll be able to not only explain that, we'll explain a whole lot of other things. So don't fool yourself, don't be an ostrich. When you've got a cyst, even if you don't have symptoms, this is what I say, because one person asked, does that mean there's no one who is well? Does your scan always pick up something wrong? It does. I promise. It doesn't mean when it picks up something wrong, it always is something serious. But it will pick up, if then you might be having maybe a toe that's bothering you, which maybe it gets itchy. You just rub it on the floor, but you don't know that it's saying something. So it picks up everything. And even with me, because one lady from Lesotho asked, tell me, do you ever get sick?
Do you ever?
I do. But it's just that I don't give a chance of the sickness to nail me, because I can pick up. I go to the scan, I say, you know? So, because you must also understand that the way God has created the body, we're not meant to be eternally here.
Yes.
We cannot fool ourselves. Whether we want to be well, when God has given you that period, He also gives us the healing gift. So that we live okay, we serve Him, we serve humanity, we what. But it doesn't mean we're going to live forever. So the body has therefore been created such that it deteriorates, depending also mostly on how you live your life. Because I mean, there are countries where people live way over 100. Whereas where we're eating the burgers and the pizzas,
The junk food.
All the junk food. Now it's younger people who are dying faster than older people. You know, because of all the waste and the vaping and the drinking and the what, everything that's just finishing that body, you guys are on with it. So therefore you live, your lifespan is shortened compared to, not even to ours, to ours it's better compared to yours, but to your great, it's even better. So the lifestyle has got a lot to do with how your body will deteriorate. So therefore, everybody, the scan will always pick up something. It will always pick up something. It doesn't mean, like I've said, that it picks up everything is complex, is serious stuff. But it just says maybe you need to sort out with the supplements there. You need maybe a malnourished, because I get people with neutropenia who are not sick, but their neutrophil count is on the low. So they're just candidates for any infection or whatever. So all we need to do there is just to beef up, their neutrophil count, tell them what supplements they must take and all that. So it doesn't mean when I scan you will always pick up serious stuff. Serious stuff is when you are really sick. But people who just want to check, like they say, I go to my doctor every year just to see if you must come to mama every year, because I will be able to guide you in each and every single thing before it gets worse. I think maybe people are dying to know, how then am I going to treat Jason? Because here's the guy who comes with just a knee, and I pick up this, I pick up that, I pick up that, I pick up that. And the nice thing is, the things that I'm picking up, he is conscious of. It's just that he didn't realize that they are linked to or that they would connect to the knee, or he can do something about them. In the next show that we're going to present, I'm actually going to be mapping out how I would go about treating someone like Jason. Because like you saw when I was analyzing, I was giving his results, you see how complex, how the brain is affected, how the pancreas is affected, how it affects his cellular dehydration, how he gets seizures, how he all those things that I mapped out, because they link to his endocrine system. So when I'm treating him, therefore, I'm going to present in next week, in the next episode, I'm going to present how I will actually treat Jason. Where do I move from? And it's important for people to watch this show. Why? Because people will say, okay, now that you have worked out all these protocols, because remember, when I work out protocols, I base them on what I've picked up. I don't just throw. I base, okay, this is what I'm picking up in your case. And so you need this, you need that, you need that. And then when all that is collected, you find it's a bit pricey. And then a person will say, can you start with the most important one? That's the common one. Can you start with, as the same talk, people will say, start with the most important one. Whatever I pick up in the scan is important. Once it shows up its tentacles, it's important. The only difference is that how I structure, because for instance, if I may just touch a little bit on a person who's getting seizures, but who doesn't come because of seizures, who just come because of knee. And then maybe has only got money that would either pay for the knee or for the seizures. So where would you go? I would actually do the seizures instead of giving for the knee. Say, enjoy the knee until we can raise, but the seizures, because they're damaging your brain. Each time you're getting those seizures, like for instance, he was saying he gets jittery. When he's about to sleep, he gets jittery. but the damage is getting done. Even though he may not be experiencing, and he also gets lots of headaches. That's the other thing he mentioned, that he gets a lot of headaches which are linked to those seizures, but also to the dehydration because of the insulin. So what I'm saying therefore is that I look at the emergency of the system that is affected. That okay, this one has got extensive damage that may lead to a whole lot of other catastrophes, whereas this one you may endure. Okay, so but we will give that show next week or in the next episode. So make sure you don't miss it, so that you can see and tell your doctor to watch also.
Taking tips.
Thank you, viewers, for watching. Hope we did bring some clarity today. Enjoy your day.
Thank you so much, viewers, for watching. We're hoping that you'll continue watching the episode of Dr. Alternative. Thank you so much.
That's where we're going to end our show today. Like I've said, thank you for your comments, contributions, and your questions. And good.